Hallucinations are where you perceive something that isn't real. So a visual hallucination is when you see something that actually isn't there, or where you hear something, music, voices, that aren't actually existing. Hallucinations are quite common in dementia. Up to 3/4 of people with dementia will experience these psychotic symptoms. It is really important to say that hallucinations are not necessarily distressing. They can be quite happy, friendly hallucinations, for instance, of rabbits or dogs or children. They can also be distressing, and it can be very difficult for a person with dementia to deal with the fact there are 4 children, imaginary children, but 4 real children to them in their living room, and they get very upset about how they're going to feed them or whose children are they. So even when they can be quite comfortable hallucinations, they can still cause some distress. You will often see hallucinations occurring in people who have dementia with Lewy bodies. Very classically, they are vivid visual hallucinations, but they are also common in Alzheimer's disease. Auditory hallucinations, where someone is hearing voices, are a little less common and can also be quite distressing. When a person with dementia has a hallucination, they experience it as being real. It is very much there, and we have to be very aware of that and be sympathetic towards that when we manage it. Some people who experience hallucinations actually know that they are not real. There are a number of reasons why hallucinations might occur in dementia. It's common anyway, but if you have an infection, if you develop delirium, if you're in pain, all of those things can mean hallucinations occur more commonly. If a person's experiencing hallucinations, they may well be experiencing other behaviours and psychological symptoms of dementia. There is quite a strong link between hallucinations and aggression, for instance. Hallucinations can also be more common if there is sensory impairment. For instance, if someone has visual impairment and they're not wearing their glasses, they are more likely to have visual hallucinations. And it's very similar with someone who's deaf and is not wearing their hearing aid. There are other causes of hallucinations, particularly the side effects of some drugs and also drug withdrawal. More rare causes of hallucinations can be brain disease, particularly brain tumours.
At Dementia Support Australia, we help you understand the changes in behaviour that may be impacted by things such as pain, the environment, communication and approach, and the importance of knowing the person that you provide care for. There is a unique story and experience behind every behaviour. Every person with dementia is unique and individual, and we tailor our support to meet their needs.